I have this friend, right? And he's completely obsessed with living forever. Seriously, his kitchen counter, it's not really for cooking. It's more like a shrine to longevity. It's just covered in this like bewildering array of amber and white bottles, all neatly arranged like some kind of miniature city. You've got powders for his mitochondria, tinctures for his telomeres, capsules for, well, everything in between. He even has a spreadsheet, to track his intake, follows maybe a dozen different biohacking gurus online. And he truly believes he's on the cutting edge of science, like meticulously building his defense against aging, one very expensive pill at a time. So the other day, the elevator in his building was out. We had to take the stairs, just 3 flights, not a big deal, right? But by the top, he was literally leaning against the wall, totally winded, flushed red, and his fitness tracker was just beeping angrily at him. And it was just this moment of stark contradiction that really struck me. All this immense faith, effort, and frankly, expense poured into this incredibly complex system of supplements, completely undermined by a simple flight of stairs. It's this paradox you see everywhere, isn't it? This deep yearning for a magic bullet, a pill that'll just solve the problem for us. But what if the most powerful medicine for a long, healthy life isn't actually in a bottle at all? That's really the idea we want to unpack today. What if the real secrets to a longer, healthier life aren't about all this cutting-edge biohacking or expensive supplements? What if it's about simpler, evidence-based lifestyle changes that are, honestly, often free? And if that's actually true, why isn't everyone doing it? Why is it so incredibly hard for us, for you, to adopt these proven behaviors, even when we know they're good for us?
It's a fascinating question, and it really is a multifaceted challenge, isn't it? As your friend's story so vividly illustrates, it goes way beyond just individual choice or, sheer willpower. We're talking about things that are deeply ingrained, like human psychology, the very structures and incentives built into our healthcare systems, and perhaps most importantly, the profound, often invisible impact of societal inequities. So our mission today is really to dive deep into these different layers, to try and understand what truly stops us from living healthier lives, despite this growing mountain of knowledge telling us exactly what works.
Yeah, my friend's experience, and honestly, when I think about it, so many of our own experiences, they really highlight this core tension, don't they? This desire for an easy button, like especially when it comes to our health. It plays directly into a really fundamental human tendency, something that feels almost wired into us. And here's where it gets really interesting for me thinking about this. I've been pondering that frustrating gap between knowing what's good for us and actually, doing it. I saw a post on a health forum not long ago that just really stuck with me. It was from a man, let's call him Arthur. He's a 52-year-old accountant somewhere in the American Midwest. After a checkup that was, let's say, pretty concerning, his doctor gave him the standard, very sensible advice: lose 20 pounds, move more, eat better. Simple, right? Arthur knew the doctor was right. He absolutely knew it. And he started off with real determination. Bought new running shoes, a big bag of spinach, the whole deal. But then life happened, as it does. Tax season hit, which meant long, grueling hours. He was stressed out about his aging parents, and then there was just that constant, almost siren-like pull of convenience. You can probably picture it, can't you? The spinach wilted, forgotten in the fridge, while he ordered pizza after another draining day. Those running shoes. Yeah, they gathered dust in the closet. And every night, exhausted on his couch, scrolling on his tablet, he'd see these ads pop up. The one pill to boost your metabolism, or reverse aging with this simple supplement. Ugh! And they were just so seductive, weren't they? Promising all the results without any of the actual struggle. He wrote in his post, and I'm quoting him here because it's so powerful, "I feel like I'm fighting a war on 2 fronts. One against my own habits, and another against a world that wants to sell me an easy, magical answer." Arthur's struggle, I think, just perfectly illustrates this core behavioral challenge we all face. We are, fundamentally, wired to seek the path of least resistance. It's human nature. And the wellness industry, well, it knows this. And it masterfully exploits it. His struggle isn't just about personal weakness, not at all. It's a predictable human response to an environment that relentlessly offers instant gratification. The hard work, the unglamorous work of what we call lifestyle medicine, the daily consistent choices about diet, exercise, sleep, it simply can't compete with the incredibly powerful marketing of a pill for every ill.
Yeah.
This really highlights a core barrier for us. We're not just trying to sell health. We're actually trying to change deep-seated human psychology in a world that often feels specifically designed to work against those efforts.
That's a really powerful way to frame it. In Arthur's experience, it absolutely resonates with what research consistently confirms. One of the primary personal barriers, just as you touched on, is exactly this concept of willpower and self-discipline. It really is a daily fight against these ingrained behaviors, these habits we've built up over years. And it's a battle that many, many people feel like they're losing. We see this across all age groups, definitely, but it seems particularly pronounced for older adults, say people over 40. They often struggle more to adapt to new, healthier routines after decades of established habits. It's just harder to change course. Willpower, fundamentally, it's our capacity to exert self-control, right? To choose the difficult, beneficial, long-term option over the easy, immediate gratification. But it's not some boundless resource. It's much more like a muscle. It can actually get fatigued. So when you're constantly making decisions all day, dealing with stress, or simply trying to navigate a complex modern life, your willpower gets depleted. And that's precisely when those unhealthy, convenient choices become almost irresistible. You just don't have the energy to fight them off.
We even see evidence of this really early in life. Studies show that children who exhibit more self-control at a young age are statistically less likely to become overweight later on. It suggests they've already started to develop that crucial capacity for delaying gratification.
Right. So it's not just about knowing what's right, is it? It's also about having the mental energy, the bandwidth, to actually do what's right day after day after day.
Exactly. And then compounding that internal struggle is the sheer deluge of confusing and often contradictory health messages we encounter literally every day. Just think about it for a second. One day, a food is celebrated as a superfood. The next day, it's demonized. What was healthy yesterday is suddenly unhealthy today, and then maybe back again tomorrow. This constant flip-flopping, especially when it's amplified by social media, where, let's be honest, anyone can position themselves as an expert, it creates this overwhelming landscape of unreliable information. It makes it incredibly difficult for individuals, for you, to trust even the legitimate guidance you might receive from medical professionals or public health campaigns. People just get fatigued by all the conflicting advice, they get confused, and often they just throw up their hands and default back to what's easy, familiar, or, what tastes good right now.
That makes perfect sense. I mean, it's really hard to stay motivated when you're not even sure what you're supposed to believe anymore. But it's not just what's happening inside our own heads, is it? Our social circles, our friends and family, they must play a huge role too.
Oh, absolutely. It's definitely not just internal battles. Our social circles profoundly influence our health choices, sometimes in ways we don't even realize. We often see how negative attitudes from friends and family, or sometimes just the pervasive influence of their unhealthy practices, can really undermine someone's personal efforts. Take family gatherings, for example. There's often just an abundance of food, right? And frequently, there's this subtle, or maybe not so subtle, pressure to eat more, to try everything. Resisting that can almost feel like a personal affront to the host, or like you're judging others. We've heard countless stories in studies where people talk about friends maybe ridiculing their healthy eating habits. Or, that social stigma around choosing a salad over what might be seen as more masculine options like beer and cigarettes. One participant in the study actually noted quite tellingly, eating your salad is girly or whatnot. That says a lot, doesn't it? And beyond outright ridicule, there's also just the simple discomfort of saying no when friends offer unhealthy food. You worry about being seen as a spoil sport, or maybe someone who isn't fun anymore. This really highlights how deeply intertwined our health choices are with our fundamental desire to simply belong and be accepted by our peers.
That spoil sport feeling is so real, isn't it? It's like your kale smoothie is silently judging everyone else's burger and fries. It definitely shows how much our need for social connection impacts these seemingly personal choices. Okay, what about just the everyday grind, the practical realities of life? How do those factor into this whole picture?
Well, the everyday grind, as you put it, creates these immense situational and environmental pressures. Life's demands very frequently clash head-on with our best healthy intentions. Time constraints, for instance, are a huge one for almost everyone. You've got competing priorities, demanding jobs, the endless cycle of household chores, and especially for women and parents with young children, childcare responsibilities just constantly erode any potential free time. We've heard participants in studies mention how incredibly hard it is to find even a moment for themselves. Someone said, because sometimes, frankly speaking, children are young, and it is hard for you to have any free time for yourself. When you're constantly running on empty, just trying to keep all the plates spinning, making time for exercise or preparing a healthy meal from scratch often feels like an absolutely unattainable luxury. Financial constraints are another major hurdle. Healthy food is very often perceived as more expensive than unhealthy alternatives, and in many cases, it actually is. If you think about the economics of it, processed, high-calorie foods often benefit from agricultural subsidies, massive economies of scale in production, and much longer shelf lives. All of that makes them incredibly cheap and ubiquitous. So a family on a really tight budget often has to prioritize getting enough calories over getting optimal nutrients, simply to make ends meet. It's a tough choice. And then there's just the sheer ready availability of unhealthy food. Fast food is convenient, it's cheap, and it's available at almost all hours. It's a very tempting option when time and energy are low. Eating food delivery services, while incredibly convenient, can inadvertently encourage ordering larger portions, more frequent snacking, maybe eating at odd hours, all contributing to less healthy habits. Beyond food, even in places that do have parks or exercise areas, safety concerns can be a significant deterrent, especially for certain groups. Some people worry about dimly lit paths or maybe paths shared with fast cyclists and unpredictable children, which increases the perceived risk of accidents, particularly for older adults. The lack of good, safe, dedicated cycling tracks in many urban and suburban environments also discourages active commuting or just recreational biking.
Right, so it's almost like the entire modern environment is subtly, or maybe not so subtly, pushing us away from making healthy choices. And then you have major global events like the recent pandemic just piling on top of all that existing pressure.
Precisely. The COVID-19 pandemic, for instance, had a dramatic impact on lifestyles on a truly global scale. You had social distancing measures, gym closures, even the requirement of wearing masks, especially in hot weather, became significant barriers to physical activity for many. This directly led to documented increases in sedentary behavior across populations. But beyond those practical limitations, there was also the pervasive fear of infection. That was a major deterrent for many people, keeping them indoors, less active. And we can't forget the associated stress and anxiety, which also fueled unhealthy coping mechanisms like comfort eating or increased alcohol consumption for some. It really was a perfect storm in a way, exposing and often exacerbating many of these underlying barriers we've been talking about.
Wow, yeah. That paints a pretty stark picture of all the different forces working against us when we try to live healthier. So, okay, if these are the barriers we're constantly up against, what are the counterforces? What actually helps people overcome these deep-seated challenges and make those healthier choices stick?
That's the critical follow-up question, isn't it? What actually works? And interestingly, the facilitators, the things that help, often directly oppose the challenges we've just discussed. They essentially flip the script. So on the personal front, the inverse of a lack of willpower is perhaps predictably strong willpower and motivation. But it's not just something you either have or you don't. Willpower can actually be cultivated, like strengthening a muscle. Individuals who manage to find their intrinsic motivation, maybe it's the deep desire to be active with their grandchildren or to feel energetic enough for a beloved hobby, they are far more likely to adopt and, crucially, maintain healthy lifestyles over the long haul. And very importantly, it's not just about knowing abstract health facts. It's about developing practical knowledge of how to live a healthy lifestyle, understanding how to meal prep efficiently, how to realistically fit exercise into a busy schedule, or how to navigate those tricky social pressures with grace. That empowers people to make informed and sustainable choices. It's really the practical application of knowledge that makes the difference, not just knowing the theory.
That makes a lot of sense. It's like building a robust internal toolkit for dealing with all those external pressures. Now, what about technology? We just talked about how social media can spread misinformation and tempting ads, but surely technology can also be a force for good in all of this.
Oh, absolutely. Modern technology, when it's used thoughtfully, can be an incredibly powerful tool for promoting health. It's definitely not just about pushing quick fixes. Firstly, it offers just unprecedented access to reliable information on diet, exercise, mental well-being, though of course you always have to be discerning about your sources online. But beyond just information, many apps and wearables are actually phenomenal tools for aiding in training, tracking, and monitoring things like physical activity, heart rate, sleep patterns, even food consumption. For example, specific apps like Strava are incredibly useful for cyclists and runners. They provide detailed data on heart rate, distance, speed, elevation, turning exercise into this quantifiable, goal-driven activity, which many people find motivating. Then you have apps like MyFitnessPal, which are excellent for calorie tracking, listing meals, and calculating nutritional goals. They really help people stay accountable to their dietary choices day to day, but it really goes beyond mere tracking these days. Many apps can send personalized reminders for things like taking short breaks for deep breathing exercises, doing a quick meditation, or simply reminding you to get up and walk around after sitting for a long time. Little nudges. And then there's this fascinating area of what we call persuasive technology, which is often embedded in smartwatches and other wearables. These devices can gently nudge users with encouraging messages, celebrate small achievements, like hitting a step goal, and crucially, allow you to share your progress with online communities or friends. This social sharing aspect fosters accountability and can even spark friendly competition. It cleverly harnesses that social element we discussed earlier, the influence of friends, and kind of redirects it for positive health outcomes. It often leverages principles from behavioral economics by gamifying healthy habits, providing that immediate positive feedback, and tapping into our natural desire for social validation and connection.
Okay, so we've explored the personal battles, the psychology, and also the individual tools like technology that can help us. But this isn't just about individual choices or willpower, is it? There's this huge structural piece to the puzzle. It's really about how our entire healthcare system is fundamentally set up. Let me try and put you in the shoes of, say, a young, idealistic doctor for a moment. I heard a story recently about a general practitioner, let's call her Dr. Evans, working in the UK's National Health Service, the NHS. She went into medicine because she genuinely wanted to make a real difference in people's health and lives. That was her driving force. Yet she described her daily reality as feeling trapped in a prescription factory. That's her term. Picture this scenario. A patient comes into her office. They're overweight, maybe pre-diabetic, have high blood pressure, a very common profile. Dr. Evans has, on average, maybe a 10-minute appointment slot. That's it. She knows, deep down, that this patient doesn't just need another pill. What they really need is a comprehensive, holistic plan. Things like nutritional counseling, maybe a referral to a consistent exercise program, perhaps even some mental health support to address underlying issues like stress eating. But the system, as it currently stands, simply isn't built for that kind of deep, time-intensive engagement. Prescribing metformin, that takes maybe 2 minutes. Having a deep, empathetic conversation about lifestyle change, exploring the patient's motivations, identifying their specific barriers, that takes 20 minutes, maybe more, time she absolutely does not have in her schedule. And there's no billing code, no financial incentive for inspiring a patient to walk 30 minutes a day. It's just not valued in the same way. So she feels this profound sense of futility sometimes. She's managing symptoms, reacting to diseases that have already taken hold rather than proactively preventing them in the first place. She feels like she's acting as a reactive technician in a system that ultimately pays for sickness, not as a proactive healer in a system that truly invests in wellness and prevention. When you hear a story like Dr. Evans's, it becomes strikingly clear, doesn't it? Blaming individual doctors for overprescribing completely misses the fundamental point. Dedicated professionals like her are often trapped in a framework that heavily incentivizes a pill-centric model of care. Her frustration isn't a personal failing, it's a direct reflection of a systemic failure. For population health to genuinely improve, the entire structure needs reform. We need to fundamentally change the incentives, allow for longer consultation times for complex chronic issues, and seamlessly integrate professionals like nutritionists, health coaches, and physical therapists into primary care teams. Dr. Evans's story isn't about one doctor's struggle. It's a powerful argument for a top-down policy shift, moving us from a reactive medical system to a truly proactive, integrated health system.
That example just perfectly encapsulates the core problem we're facing. Our current healthcare model in most developed nations is largely reactive. It's primarily designed to treat sickness after it occurs, rather than focusing resources and efforts on proactively preventing it from happening in the first place. This inherent focus on treating illness inevitably leads to what we've been calling a pill-centric approach because, honestly, it's often the quickest, most direct, and most easily reimbursable way to address symptoms within the existing framework. There's an urgent and absolutely critical need for a complete paradigm shift here. We need to move towards a proactive system that genuinely promotes health and strategically leverages investments in prevention. And this challenge is significantly compounded by major global demographic shifts, especially the reality of an aging population and the escalating burden of chronic diseases that comes with it. If you look at Europe, for instance, it's rapidly aging. Its median age is projected to climb significantly over the next few decades. Now, this isn't just a dry statistic. It means more people are living longer, which is great, but crucially, they aren't necessarily living healthier years. This creates immense and steadily growing pressure on our healthcare systems. We see this reflected starkly in the data. In 2022, over 60% of people over the age of 65 in the EU were affected by chronic diseases. That's nearly double the rate of the general population. And this leads directly to a substantial increase in what are termed unhealthy life years, basically the number of years people live with limiting health conditions or disabilities. That figure actually rose by a full year between 2017 and 2022 alone. That represents a huge societal burden, both in terms of human suffering and, of course, escalating economic costs.
Right. So it's not just that people are getting older, but a large portion are aging into illness, which puts an incredible strain on already stretched healthcare resources. And what about the economic realities that are tied into all of this?
Exactly. And adding another layer of complexity here are significant economic and fiscal constraints. Many regions, including Europe, are experiencing slower economic growth compared to other major global economies. This directly limits the governmental resources available for funding health and welfare systems. Compounding this, many countries have high levels of public debt, which means governments have less fiscal flexibility to make significant investments in long-term, proactive health strategies, even if they know it would pay off eventually. Many economists actually describe Europe, for example, as being in a state of permacrisis, this kind of persistent, overlapping, and compounding series of major challenges. Think of it as a relentless barrage of factors: the ongoing impacts of the pandemic, geopolitical conflicts and instability, rising social tensions, the cost of living crisis, and even the escalating climate crisis. Each of these alone is a major strain on resources and public well-being. But taken together, they simultaneously erode public health and make it incredibly difficult for policymakers to focus on, let alone implement, long-term proactive health strategies when they're constantly just trying to put out immediate fires. And despite really clear evidence showing the long-term economic benefits of prevention, everything from increased workforce productivity to significantly reduced healthcare costs down the line, there's been this consistent and, frankly, alarming underinvestment in this area. In the EU, for example, spending specifically allocated to health protection and prevention was a mere 6% of total public health expenditure back in 2021. Now compare that to over 65% allocated directly to treating existing illnesses. It's a really striking imbalance, isn't it? Many EU countries spend less than 0.5% of their entire healthcare budget, specifically on immunization programs, even though immunization is consistently ranked as one of the most cost-effective public health interventions available. This kind of short-sightedness means we're constantly paying significantly more down the road to fix problems that could have potentially been prevented far more cheaply and effectively.
Wow, 6% versus 65%. That's a staggering disparity. It really shows where the priorities lie, systemically speaking. And I imagine the people actually working on the front lines, the healthcare workers themselves, are bearing the brunt of all this systemic pressure.
Absolutely. We absolutely cannot overlook the profound challenges facing the healthcare workforce itself right now. First, we have an aging healthcare workforce. In the EU, for instance, over 40% of physicians are actually over the age of 55. That means a significant portion are nearing retirement age, leading to potential shortages. This is coupled with chronic understaffing in many areas and widespread issues of burnout, which were significantly exacerbated by the pressures of the pandemic. All of this directly impacts the quality and availability of care for patients. It means longer wait times, potentially less personalized attention during appointments, and often less capacity for doctors and nurses to engage in those longer, more complex, but crucial conversations about lifestyle changes and prevention that we know are so important. And this impact is often particularly severe in rural or underserved areas where access to healthcare professionals is already limited, creating literal care deserts. This whole combination of factors paints a pretty clear picture of a system under immense strain, just struggling to meet current needs, let alone find the resources and capacity to fundamentally pivot towards a more proactive, preventative model.
Okay, so the system is largely designed to treat sickness, it's overwhelmed, under-resourced in key areas, and facing demographic pressures. How do we even begin to shift a massive shift? What are the actual policy levers, the organizational changes that could truly make a difference and start moving us from reactive care towards proactive health?
That really is the billion-dollar question, isn't it? And the answer suggests we need fundamental systemic changes, moving well beyond just telling individuals to make better choices, and focusing instead on broader policy reforms and structural adjustments. For instance, the European Union has actually introduced something called the New Economic Governance Framework, or NEG, which became effective in April 2024. Now, this framework is potentially a crucial step because it explicitly allows investments in prevention to be considered social security investments. What this means in practice is that it provides greater fiscal flexibility for governments to spend money in this area, formally are recognizing the positive ripple effects of prevention, not just on public health and individual well-being, but also on broader economic growth through things like increased productivity and reduced absenteeism from work. It's a way of trying to embed the idea of long-term health as an economic asset, not just purely as a cost to the system. Another really critical setting for promoting health is the workplace. I mean, think about it. Most adults spend a huge portion of their waking hours at work. This makes the workplace an absolutely ideal environment for integrating health promotion initiatives into people's daily routines, making healthy choices more convenient and accessible. We've seen some really effective initiatives that are often relatively simple but can have quite profound impacts. Things like companies offering monthly fruit giveaways or subsidized fruit bazaars, running educational sessions on nutrition and healthy eating during lunch breaks, or even organizing group exercise classes. And during the pandemic, many companies got quite innovative, offering online fitness classes or mental wellness resources, showing that these programs can adapt and still effectively integrate health promotion into the busy lives of employees, essentially making the healthy choice the easier choice within that context.
That makes a lot of sense to meet people where they actually are and where they spend so much of their time anyway. Beyond these kinds of broad policy shifts and workplace initiatives, are there specific preventative programs that have shown clear, tangible benefits that we should be focusing on?
Oh, absolutely. Specific prevention programs are absolutely vital, and some of them have truly dramatic, well-documented impacts. Take cancer screening, for example. Early detection through established programs like mammograms for breast cancer, colonoscopies for colorectal cancer, and HPV tests for cervical cancer can significantly reduce mortality rates. The data here is incredibly compelling. Just a 10% increase in the uptake of these screenings can lead to really substantial reductions in deaths. We're talking about potentially a 21% reduction for colorectal cancer deaths and a remarkable 40% reduction for cervical cancer deaths. And it's not just about saving lives, though that's obviously paramount. Early detection also dramatically reduces the overall cost of treatment. Treating stage 1 cancer, for instance, is often significantly less expensive and much less invasive for the patient than treating stage 4 cancer, which eases the burden on individuals, families, and the healthcare system as a whole. And then, of course, there are immunization strategies. Vaccination is, without a doubt, one of the most highly effective and incredibly cost-efficient methods we have for preventing a wide range of infectious diseases. It contributes hugely to both individual protection and broader community or herd immunity. We saw the immense power of this during the COVID-19 pandemic. Estimates suggest that COVID-19 vaccines saved over 1.6 million lives in the WHO European region alone between 2020 and 2023. A staggering number. But beyond directly preventing diseases like COVID, immunization also plays a crucial, often overlooked role in combating the growing threat of antimicrobial resistance, or AMR. By preventing bacterial and viral infections that would otherwise often require antibiotic treatment, vaccines indirectly reduce the overuse and misuse of these precious drugs, which is the primary driver of antibiotic resistance. And AMR is truly a silent, growing global crisis. It's already estimated to cause over 1.3 million deaths globally each year, and around 35,000 deaths yearly just in the EU. Projections suggest this could rise to a terrifying 10 million deaths per year globally by 2050 if we don't take urgent action.
10 million deaths a year from AMR. That's a truly chilling statistic. So vaccines are essentially fighting on multiple fronts, then protecting us directly from specific diseases and helping to preserve our ability to treat other bacterial infections in the future.
Precisely. It's a double benefit. And the economic arguments are incredibly strong too. Studies estimate that every €1 spent on adult vaccination programs can generate an incredible €19 return to the broader health and social care economy through avoided illnesses and productivity gains. For specific vaccinations, like the annual influenza vaccine, we see estimated cost-benefit ratios reaching as high as 174 to 1. These are just staggering returns on investment from a public health perspective. However, despite these overwhelming benefits, we do face ongoing challenges in maintaining high vaccination rates, things like vaccine fatigue, a kind of general weariness resulting from repeated vaccination campaigns, especially post-COVID, and sometimes a pervasive lack of awareness about the immense value of adult immunization beyond childhood schedules. We've actually seen a worrying decline in public perception recently. Only about 81.5% of the EU population believed immunization was important in 2022, which is down quite significantly from nearly 90% just a few years prior in 2018. This just goes to show that even the most effective and beneficial interventions require sustained public health messaging, education, and ongoing efforts to build and maintain public trust.
Okay, so we've talked quite a bit about the personal struggles, the individual psychology, and also the big challenges embedded within our healthcare systems themselves. But let's zoom out even further now and look at the even bigger picture. Those powerful societal forces that shape our health, often in ways that are completely beyond our individual control. This is where the really profound and critical idea of health equity truly comes into play. I want you to try, just for a moment, to imagine a day in the life of a woman. Let's call her Sophia. She's a single mother, maybe has 2 young kids, living in a low-income neighborhood in a large city. It could be Los Angeles, could be London, could be anywhere, really. She works 2 jobs just to make ends meet. Maybe one as a cleaner early in the morning, another in food service late at night. Now she sees the articles online, maybe catches segments on daytime TV, talking about the 7 keys to a long, healthy life. You know the ones. Let's just briefly consider how those standard keys actually apply to her lived reality. Key 1, eat more fruits and vegetables. While the only grocery store within easy reach in her neighborhood is a small convenience store where fresh produce is incredibly expensive, often poor quality, and very limited. Meanwhile, processed, high-calorie, shelf-stable foods are cheap and absolutely abundant. A food desert isn't some abstract concept for Sophia, it's her daily shopping reality. Key 2. Get 30 minutes of exercise a day. Between her 2 jobs, commuting, and caring for her kids, when exactly is she supposed to find that time? A gym membership is an impossible luxury, and maybe her neighborhood doesn't feel safe for a walk or a run after dark when she finally gets home. Key 3. Get 7-8 hours of quality sleep. This must feel like a cruel joke to someone who has to wake up at 5 a.m. for her first job and doesn't get home until after 10 p.m. from her second, constantly worried about the next day's bills and logistics. Key 4. Manage stress. Her stress isn't some abstract concept she can meditate away. It's constant, it's palpable, and it's entirely rational. It's about paying the rent, keeping her kids safe, putting food on the table. For Sophia, those 7 keys aren't a simple checklist she can just tick off. They represent, in effect, a mountain of privileges: time, money, safety, access that she simply doesn't have access to. Hearing a story like Sophia's, it's hard not to feel a profound sense of injustice, isn't it? It's such a powerful, sobering reminder that health is absolutely not just about personal choice, nor is it solely about the efficiency of the medical system. Sophia's story brutally exposes those deep socioeconomic determinants that effectively make healthy living feel like a feature of affluence, a luxury good almost. For millions of people around the world, the primary barriers to health are not psychological. They are structural, economic, and deeply rooted in systemic inequality. This demonstrates so clearly that public health interventions cannot just be about providing information or telling people what to do. They must fundamentally be about achieving equity. And that means pushing for policies that genuinely ensure everyone has access to affordable, nutritious food, creating safe, well-maintained public spaces for recreation in all neighborhoods, and crucially, supporting working families with things like a living wage, affordable childcare, paid sick leave, and better, more flexible working hours. Without addressing these deep underlying inequalities, advising someone like Sophia to simply challenge her brain or eat a healthy diet is not just unhelpful, it's profoundly out of touch with the reality of her daily struggle.
Sophia's story is indeed a stark and incredibly powerful illustration of these socioeconomic determinants of health. It really lays bare the harsh reality that the health disparities we observe across populations are not random occurrences at all. They're deeply rooted in systemic issues, in inequality. And we've actually seen some deeply concerning trends recently. Since about 2014, life expectancy in the U.S., for example, has actually decreased overall, a very rare event in a developed nation. And this trend is particularly pronounced among Black and Hispanic adults. In 2020 alone, overall U.S. life expectancy dropped by a whole year, but Hispanic and Black individuals saw even sharper declines, almost 3 years and 2 years respectively, just between 2019 and 2020. This strongly indicates that underlying vulnerabilities and inequities are being significantly exacerbated by broader societal factors. The COVID-19 pandemic, as you rightly highlighted earlier, vividly and tragically exposed these shocking disparities. It disproportionately affected Black, Indigenous, and people of color, or BIPOC Americans. The data showed that while almost 80% of COVID-19 deaths by March 2021 were among people 65 and older, American Indian, Alaska Native, Hispanic, and Black individuals faced a significantly greater risk of dying from the virus compared to white individuals, even after adjusting for age. This pattern, sadly, isn't new. It's not unique to COVID. We've seen similar disparities consistently emerge across a whole range of chronic conditions, like cancer, diabetes, heart disease, hypertension, and obesity, for decades. A significant underlying factor here, and it's something we absolutely have to confront, is the impact of racism and discrimination. Both overt, explicit racism and the more insidious implicit biases that permeate society and institutions. Studies have actually demonstrated clear biological impacts linked to experiences of racism. For instance, one study found that older Black men who reported experiencing more racism throughout their lives had measurable inflammation in their brains, a factor that can potentially increase the risk of strokes. Similarly, another study showed that minority women who reported experiencing more racism experienced an accelerated progression of chronic kidney disease. Experts in this field, like Dr. Alohi Ahankai, rightly emphasize that these persistent health disparities are not due to inherent differences in skin color or genetics. They are profoundly rooted in social differences and what we collectively term the social determinants of health.
Right. So it's about the cumulative impact of everyday lived experiences of discrimination, stress, and disadvantage, literally translating into poorer physical health outcomes over time. It's not some inherent biological predisposition. That's a really crucial distinction to make. Can you break down those social determinants you mentioned a bit more for us? What exactly falls under that umbrella?
Absolutely. The social determinants of health are essentially the non-medical factors that significantly influence people's health outcomes. They're the conditions in which people are born, grow, live, work, and age. There are several key categories we usually look at. First, economic stability is absolutely fundamental. If you lack health insurance, if you can't afford copays for specialists or necessary lab tests, or if you're constantly struggling just to make ends meet financially, preventive care often becomes an impossible luxury. Basic survival needs take precedence over long-term health investments. And this has profound impacts on mental bandwidth, too. When your brain is constantly preoccupied with the acute stress of making rent or putting food on the table, the sustained, long-term, often unglamorous effort required for significant lifestyle changes simply falls way down the priority list. It creates a cognitive load that makes things like planning healthy meals or finding time for daily exercise feel completely unattainable, forcing constant short-term, often less healthy coping decisions. Second, food security is another critical determinant, as we saw clearly in Sophia's story. The lack of reliable access to healthy, affordable food creates what are known as food deserts or food swamps, where fresh produce is scarce and expensive, while processed, calorie-dense, nutrient-poor options are cheap and ubiquitous. This directly impacts diet quality and drives rates of obesity and related chronic diseases. Third is our physical environment. Where we live, our zip code, the quality of our housing, the safety of our neighborhood profoundly impacts our health. Concerns about dimly lit parks or lack of safe sidewalks, for instance, can prevent people from getting essential physical activity outdoors. Exposure to air pollution, lack of green spaces, substandard housing conditions with mold or pests. All these environmental factors can contribute significantly to chronic respiratory illnesses, stress, and other health issues. Then there are education and information barriers. We touched on misinformation earlier, but simple lack of access to quality education and clear, reliable health information is a major issue. Language barriers, for example, can be incredibly isolating, preventing people from understanding crucial healthcare instructions from their doctor, knowing how to navigate the complex healthcare system, or participating fully in community health programs. We heard one study participant explicitly mention this, saying, "I just hate to go to some of these community activities. They're all in English and I won't understand." That simple barrier can effectively disconnect entire communities from vital health resources and social support networks. And finally, community and social context matters immensely. This includes factors like social isolation, community cohesion, civic participation, and exposure to discrimination. For instance, research has shown that fear of authorities, such as fear of immigration and customs enforcement, ICE, among the Latino community in the U.S., can significantly affect people's willingness to seek necessary medical care, even for serious conditions, because they fear potential deportation for themselves or family members. This pervasive fear can create a dangerous, self-perpetuating cycle of delayed or completely avoided care, inevitably leading to worse health outcomes down the line.
That's a really sobering overview of just how deeply embedded these challenges are, affecting everything from finances to neighborhood safety to language. It almost sounds like even when individuals from minority or disadvantaged groups do manage to overcome some barriers and gain socioeconomic advantages like higher education, they might still not reap the same health benefits as their more privileged counterparts. Is there a term for that phenomenon?
Yes, exactly. There is indeed a concept that describes this, known as the minorities diminished returns theory. It basically posits that while achieving higher levels of educational attainment generally acts as a strong protective factor against poor physical health for older adults across the board, this protective benefit is significantly weaker or diminished for individuals from racial and ethnic minority groups. This has been observed particularly for Hispanic whites when compared to non-Hispanic whites in some U.S. studies. Now, what's absolutely crucial here is that this theory attributes these diminished returns not to any inherent characteristics of minorities' cultures or individual behaviors. Instead, it points towards systemic factors like labor market discrimination as a primary reason. So what this means in practice is that even if a minority individual achieves a high level of education, if they subsequently face discrimination in the job market that limits their income potential, their job security, or their ability to accumulate wealth over their lifetime, then the health benefits that typically correlate with higher education are effectively eroded or diminished. This is because income and wealth strongly mediate that crucial education-health association. Essentially, the system itself often prevents equal health gains from equal educational effort, creating a cumulative disadvantage over the life course. And we can observe similar patterns of socioeconomic inequality driving health outcomes in other global contexts as well. For example, studies conducted in China have shown clear pro-rich inequalities in both physical and mental health among the elderly population there. Household income was found to be the single largest contributor to these health inequalities, accounting for over 41% of the disparity in physical health and a staggering 68% of the disparity in mental health outcomes. Educational attainment also makes a substantial contribution because, as we've discussed, higher education typically correlates with more health knowledge, better preventative health practices, and, of course, higher income levels, which enable healthier lifestyles. And consistently, across many countries, urban residents generally tend to exhibit better health outcomes on average than their rural counterparts. This is largely attributed to significantly better access to high-quality health services, more robust public health infrastructure, safer environments, and often more opportunities for stable employment and continued education in urban settings.
Okay, so we've clearly identified these deep-seated systemic barriers, economic, social, environmental, discriminatory, that truly create an inequitable playing field when it comes to achieving good health. So the crucial question then becomes, how do we start to build systems that genuinely foster health equity? What are the practical, equitable public health interventions and policy changes we need to implement to actually bridge these significant gaps?
That really is the ultimate challenge, isn't it? And it absolutely requires a multi-pronged approach, addressing issues at multiple levels simultaneously. A key area to focus on is fundamentally shifting towards truly patient-centered care and actively working to build trust, especially within marginalized communities that may have historical reasons for distrusting the medical establishment. This means creating healthcare systems where care is consistent, culturally competent, and where providers genuinely take the time to listen to patients, understand their lived experiences, and avoid layering on assumptions or biases. The tragic case we discussed earlier, that of Dr. Susan Moore, the Black physician who alleged substandard treatment due to her race shortly before her death, highlights the potentially deadly consequences of patients not being listened to or believed. An external review conducted after her death in her specific case found evidence suggesting a lack of empathy, compassion, and cultural competence, as well as the potential influence of implicit racial bias among her caregivers. Her experience tragically underscores precisely why building trust and truly listening are so absolutely vital. On a more positive note, organizations like Neighborhood Health in Tennessee exemplify what truly patient-centered, equity-focused care can look like in practice. Their core philosophy is remarkably simple, yet powerful. If you have a pulse, you can be our patient. They actively work to remove critical barriers to access, like requiring specific legal status, in order to address chronic conditions such as hypertension or diabetes effectively. They ensure care is accessible to everyone in their community, regardless of background or documentation status. We also heard from nurse practitioner Latrina Blakemore, who emphasizes the profound importance of simple bedside manner and proactively asking patients about their cultural expectations or concerns. For instance, asking something as direct as, "Is there anything that I shouldn't be doing that may make you feel uncomfortable?" This simple act of showing respect and cultural humility builds immense trust, and that trust, in turn, leads to better patient compliance with recommended care plans, which ultimately translates directly into better health outcomes, things like lower blood pressure readings or improved A1C levels for patients managing diabetes.
That emphasis on just listening, showing respect, and building trust seems so foundational, so fundamentally human, yet it often seems overlooked in the pressures of the current system. Beyond that crucial individual patient-provider relationship, what about addressing the issue of systemic discrimination more broadly within the field of medicine itself?
Yes, directly confronting and actively working to dismantle structural racism and other forms of bias within medicine is absolutely essential for achieving health equity. This requires comprehensive ongoing education for all healthcare professionals, doctors, nurses, technicians, administrators, focused on understanding implicit bias, helping them recognize how unconscious biases can subtly, or not so subtly, manifest in clinical decisions and patient interactions. It also means fostering a deeper, more empathetic understanding of the diverse lived experiences of minority patients and the historical context of medical mistrust in some communities. It really has to go beyond just raising awareness. It requires actively changing institutional practices, policies, and culture to create truly equitable care environments for everyone. And beyond the walls of the clinic or hospital, community-level interventions are incredibly powerful because they meet people where they actually live, work, and socialize. They can directly address specific local barriers in culturally appropriate ways. We see great examples from nonprofit organizations, like the Hispanic Family Foundation in Nashville, which actively works to overcome barriers like fear of authorities, transportation difficulties, and language barriers by bringing essential services, like vaccination events, directly to the community, often partnering with churches or community centers. Another remarkable example is the rise of student-run free clinics, such as the Salt Wagon Clinic affiliated with Meharry Medical College, a historically black medical school. These clinics provide essential free medical care under the supervision of experienced faculty, primarily serving uninsured or underinsured patients. Critically, they also work intentionally to build trust within communities that may have very valid historical reasons for distrusting the traditional medical system. And crucially, these clinics serve a vital dual purpose. They also educate the next generation of doctors, nurses, and other health professionals, imbuing them early on in their training with the core principles and practical realities of health equity and community-based care.
So it's really about building trust from the ground up, tailoring solutions to specific local needs, and simultaneously training the next generation of caregivers to be much more attuned to these complex equity issues. That makes sense. What about the even broader policy and infrastructure changes needed at a governmental or societal level?
Yes, that's the absolutely essential top-down foundational piece of the puzzle. Governments play a massive role in shaping the environments that either support or hinder healthy lifestyles. This includes things like investing in accessible, well-maintained neighborhood parks, safe walking and biking paths, public swimming pools, and affordable community recreation centers. The actual design and maintenance of these built spaces matter immensely. Things like good lighting, clearly marked pathways, safe equipment, and proximity to residential areas directly encourage their use and promote physical activity. Grassroots community organizations often complement these governmental efforts brilliantly by organizing free or low-cost group activities, like walking groups or community gardening projects, which can further motivate people through social connection and shared goals. Furthermore, integrating comprehensive physical education as a core, mandatory curriculum in schools is vital. It helps children incorporate regular exercise into their lifestyle from a very young age, fostering habits and skills they are far more likely to carry with them into adulthood. And continuing to offer good, accessible exercise options through colleges and universities extends this opportunity to young adults as well. On a more structural economic level, addressing income inequality is absolutely paramount for health equity. Governments need to actively work to perfect income distribution mechanisms through progressive taxation, robust social safety nets, minimum wage laws, and intensify poverty alleviation efforts, specifically designed to narrow the income gap between the richest and poorest segments of society. This will have a direct positive impact on reducing health outcome inequality, because greater financial stability translates directly into better access to healthy food, safer housing, less chronic stress, and more consistent access to health care. This also includes strengthening and improving the accessibility of medical assistance programs, specifically targeted towards low-income older adults who often face compounded health and financial challenges. Strengthening health education is also critical, but it needs to go beyond just awareness campaigns. It needs to focus on building critical health literacy, the ability for people to find, understand, and actually use health information to make informed decisions about their lives, enabling them to navigate that complex information landscape we discussed earlier. And finally, perhaps most fundamentally in the long run, increasing public investment in both basic and higher education is a cornerstone strategy for health equity. Improving the overall educational attainment of the population is intrinsically linked to better health outcomes, as it often leads to higher incomes, more stable employment, greater access to health information, and a greater sense of agency over one's life. This directly helps to alleviate educational inequality between different income groups and mitigate its subsequent negative impact on population health. #TagOutro.
So we've taken a really comprehensive deep dive today into this incredibly complex landscape of health, longevity, and all the barriers that stand in the way for so many people. I think it's become abundantly clear that the path to a long, truly healthy life isn't found in a single magic pill or some simple checklist or the latest biohacking gadget. It's really a very nuanced interplay of our own personal ruin habits, definitely supported by strong, positive social networks, but also crucially dependent on having a fair, equitable, and proactive healthcare system that fundamentally prioritizes prevention and well-being for everyone.
Absolutely. And if we step back and look at the bigger picture, look at the accumulated data and evidence, It overwhelmingly points towards comprehensive lifestyle changes. Eating well, moving regularly, managing stress, getting enough sleep, maintaining social connections. But critically, these changes need to be powerfully supported by equitable systems, smart public health policies, and community resources that make those healthy choices feasible and accessible for all. This really isn't just about individual responsibility anymore. It's a profound societal undertaking. It's ultimately about consciously building a world where the healthy choice is actually the easy choice, the default choice for everyone, not a privilege reserved only for those with the most resources or advantages.